What roles does gender play in your community pertaining to health-related issues?
In our Diné tribe, Navajo, it's maternal, obviously. So a lot of the things that are decided and such. I mean, let's face it. Generally, overall, mothers are the ones that are cooks and such. So they're the ones that figure out what their family's going to eat and etc.
Well, for me, something that I've learned early on, and I understand that it's kind of become a part of who I am and how I interact with people, is that, and I never really realized this until I got older, but I come from a matriarchal society that where women, had a lot of say and how to raise children and all of those things. And so subconsciously, I never really thought much about it and how it impacted me. And I see how it plays in my life even today when I interact with other individuals, mainly females. And so it does impact me in a sense that I first listen and then I'll respond, So I don't interject. I don't, I try to show that respect head on. And so I think that for me, that's how gender plays a role.
I think, well, I believe that coming from a single mom household, my mom had to make the best of what she had with her income. So it comes from, in my case, it was my mother. My mother was the one that bought the food, the one that knew what she was going to purchase with the amount of money that she had. So, it may be different in the different, homes. I know that in my husband's home, the mom made sure that, yes, they had a budget, but they ate totally different than how we ate. So, yes, gender does play a role because it kind of feeds on to the next generation.
So what were the differences in what your husband's family ate?
They knew they had a meal plan. They knew basically the pyramid scheme of what they needed to fit in. They rarely ate fry bread. My mom made fry bread every single day. I mean, seriously, that's huge, huge difference. And bread was white bread and wheat bread and those types of things were not in our household because my mom made the bread.
When I was adopted by my native family, that delineation between male and female in terms of, I don't want to say power in the home, that doesn't seem like the right term.
Just responsibilities.
Yeah, was very different. I mean, like my brother inherits his band affiliation from his mother. So he's on Compagre, but his father's White River. But, and he might have a different experience, but in my experience, there was a real equality in that house. There was no mother or father that was in control. They seemed to do things very equally, and there were things that they talked about, and it was not like one was telling you what to do, the other was listening. It was very equal.
What I see now as far as like gender differences between men and women is that I think the women have a lot more anxiety about health, more worry about health, and that the men don't appear, even though they probably do, don't appear to worry as much about their health or think that there's that much that they can do. I work on a team that deals with managing chronic diseases, so diabetes, high blood pressure, but I see anybody that comes in and wants to talk to me. And so for people that have diabetes in particular, there's a lot of concern from the women about what can I do, worry about what's going to happen. When you talk with the men, there's a lot more kind of this idea that there's not a lot that they can change about their health, which is very interesting to me. Mm-hmm. That it just happens, and it may just be that change is really hard and I don't know how I'm going to make these big lifestyle changes. It may be that they just accept that this is what's happened because diabetes is so rampant in our community that it's inevitable that you're going to get diabetes, and they've seen the way that people have dealt with it in the past. It's kind of hard to get into what that is.
I know that Some men know that they could take much better care of themselves and they just don't make the effort.
And why? Why do you think that is?
Well, it's like some people feel, hey, you know, this is my fate. This is what's supposed to happen, and so.
So some it's fate.
I
What
think some
else?
of it also deals just with their own mental state. You know, I mean, if they feel like they're, you know, I remember a story where my wife and I drove up to an alcohol party. It was at her brother's house, and we walked in, and she was upset that there was children around and drinking happening everywhere, and so she got upset and chased everyone home, and people were upset at her and you know, yelling back at her. And I just remember one adult, you know, walked by where we were standing. He said, you know, they're just going to grow up and drink anyway, you know. And so that was his mentality.
It's an
And
interesting
so
example.
yeah, and so I think in a lot of ways that's how we think. We know that there is resources out there to help us, but until we actually get to a point maybe where the warning signs are there, then we finally maybe take an active role in that.
The biggest issue that connects all this is, the mental health aspect of
Okay.
all of these things, because with diabetes, even though it's physical, there's also that connection with your mental health.
Right.
And if your mental health is not good, you're not going to want to focus on your
All
physical
the
health.
others. Okay. What about mental health issues? Is that discussed between men and women?
Mental health is seen really as a part of general health. People who have mental health issues or mental health challenges are more accepted within the community than we see in Western communities. It's not a stigma to have a mental
It's
health
not
issue.
taboo.
No. But I think also in our communities, mental health issues are very closely connected with substance abuse.
Okay, so let's talk about substance abuse. Is that a conversation that's happening between men and women in your community?
It's mostly like you talk to people and they just kind of joke around. We did this last night, we do this last night, and it's like it's mostly joking around but not really serious about talking about their problems. It's like, I don't know.
What do you think, Mario?
I think substance abuse has become a normal part of life.
It's prevalent in our home: alcoholism, suicide. I had a brother that died from drinking too much and decided to end it all. And he left the family. And how heartbreaking for a mother to see one of her children commit suicide and hang himself. So it is prevalent, and those things need to be addressed. So many things. My mother, we were talking about last night about the levels of the Navajo culture, and we're in the glittering area. And my mother-in-law talked about, and she used to live on the reservation where there's beer bottles just on the side of the roads, and that's the glittering on the side of the road. And I think, oh my gosh, that's so true.
So she's named it the glittering generation?
Yes, it is.
Because she drives on the reservation and
Where there's lights now. We're in that area where, there's development, there's growth.
What are the expectations of exercising in the community? And I think there could be a difference between what you had brought up between urban and reservation living. What are the expectations of exercising with men and women and also the different environments?
Well, when you're cultural wise on our end as Navajos, we were always told you get up before the sun, you run before it comes up, every morning.
Sleep. Yes, you don't sleep all day.
You don't sleep. I mean,
So
all
that's
these.
if we were living on the reservation?
Well, no.
There's not a lot of connection. I mean, I remember hearing that as a little kid on both sides. And my parents are different tribes. My mom's Hopi and my dad is Ute. And there's lots of this traditional education that teaches you how to be a good person, how to grow up, how to fit in your family and your community.
Yeah.
And there was specifics about having a healthy body and being able to be a healthy person. But I think, a lot of it definitely with our people has to do with this, trauma that's happened with the interaction of the white man coming in and changing our ways of living. And so it is really a foreign concept. And the more the generations come, the farther away I think that kids are from these ideas, that they're just stories instead of like really things that will help you to have a better life now.
See, I don't think it has to be as complicated as we make it. I mean, what's one of the best resources? Outside, go walking. But we kind of don't bother to take advantage of those very simple things. Uh, I think it can be fairly common sense as to know about knowing what's good for you to eat and what's not good. I mean, sure, I think there's a little bit more information that can be available, but we make that information available at the Urban Indian Centre. There are people there that can tell you about what you should eat and about exercising, but people don't seem to be taking advantage of it.
So they're coming to the center. It sounds like. Do you have a high number of people who participate in activities at the center?
See, and once again, it depends on what it is.
Okay.
Yeah,
So what are
Thanksgiving feast,
They're
hundreds.
there. Okay.
But health fair, 100.
Are there transportation needs and issues within the community that impact health?
There was
But-
one
yeah.
lady that came in. She had five kids,
Mm.
a
Put 'em on the
stroller, and they were coming from the tracks, and they were just
Yeah.
all in.
It's
And then
sad.
they get a referral at the walk-in center. Then they have to go downtown to the clinic there, and then it's how do they get down there?
Sure.
It's
So this would be a concern if someone wanted to work with your community. This would need to be taken into consideration.
Yep.
And so coming to your community would be perhaps a good idea, or coming to the people rather than expecting them to come to
Yeah,
you.
if I wanted to receive free health care, and if I wasn't a part of the Navajo tribe, which I am, or maybe the Ute tribe, which is 3 hours this way, I might have to go to Phoenix, Arizona to get my free health care done.
For a hospital.
Yeah, for a hospital stay. And,
Wow.
that's, 12 hours away, more,
Yeah.
if not more than that. And so transportation is huge.
Okay. What's a unique thing that you would tell someone about your community that would impact the way that they would work with you to improve the health of your...
Well, I think I think for me, it would have to be the fact that there's this idea that we have free health care to take care of all of our needs. So a good example is, I've had a kidney transplant. I now have to take anti-rejection medication the rest of my life. If I were to live on the reservation, that medication would come to me for free. I'd have that there. But because I live here, I have to pay for it like everyone else does. And so that's something different.
Sure, and people could assume completely opposite.
So I'd like to see the fact that, I could have access to that as well, even though I live here.
Okay.
To me, a lot of times as Native people, you can't just ask us, oh, hey, what's wrong with you, and get a short answer. Especially for older people, they're going to tell you a story about what's going on with them and what their symptoms are and how they're feeling. And it might not take 15 minutes to do that, right? They're used to being able, especially when you go talk to the medicine person, they're asking you a lot of questions about what's going on. You're telling them about what's happening to them. It's not just, here's how I feel, this is what's happening, you're in, you're out.
I'm working with a family right now that single mom, 3 sons, 3 boys. They've all had their own medical issues. The youngest son now is starting to develop some of these similar medical issues, and she's tried Western medicine, but now her next resort is to go back to her reservation in Montana and to see a medicine man there, to see if that's another form of care. And so I think sometimes families who are a little more traditional, they rely upon that, going back home to the reservation, meeting with the medicine man, see if they can diagnose something. And then they'll prescribe something, But you need both nowadays. You have to integrate them. And
So going to the reservation and receiving their health care through medicine men or women, what does that provide that's different from Western medicine?
Well, you have to understand what people think about what causes diseases, right?
Okay,
Because quite often we identify the disease and what it's doing in terms of what's biologically happening to our bodies physically. Now, with some with some societies, though, disease is caused by things other than the body being out of shape. Sometimes, and I'm not necessarily saying that this is the way for American Indians, but sometimes it's because you've done something wrong to someone else.
So they're in a sense maybe cursed for
Or
the
this
disease.
is the universe sort of like it's
Oh.
itself trying to establish balance. I did something wrong, and so I have to do something to amend that wrong. Otherwise, I might continue to be
Does
sick.
that kind of belief exist in the Native
Oh,
American community?
Sure,
I'm
it's huge.
with
Okay.
me. You know, when
Yeah.
sometimes when I get sick, I think, okay, what have I done wrong? Well,
Yeah,
yeah.
you need to be in balance, sort of thing, with everything. That's the thing with the ceremonies and such. They hopefully by the time you're done, you're kind of like in balance with all your mental, social, physical, everything is kind of put back in proper perspectives.
Okay.
To me, I think the most important thing is that, we're resilient people. We are still here, even though people have tried to kill us for hundreds of years. And that all of this information about how to be healthy and how to be happy and how to be whole, we have that knowledge within us. And so I think it's hard sometimes when we go and talk with mental health people or with medical people that the idea is that the doctor has all the knowledge and the stuff that we think about how to be healthy is wrong or is crazy, And so I think that we are headed in a different way. I have heard more about, the medical field understanding that ceremonies are important to us and that this is something that is just as important as going to the doctor sometimes or can be done together with going to a regular doctor or going to the hospital.